The Lagos State Health Service Commission has assured residents of providing quality and standard service across its primary and secondary hospitals in the state. This was echoed at the 2021 Health Service Commission Forum.
I have absolutely no doubt.
It's the Lagos State Health Service Commission Forum for the year 2021 at Lekki in Lagos. As part of efforts to deliver quality healthcare services to residents of Lagos, the state government has brought together practitioners in the health sector to brainstorm on how to build a world-class health system for the state. The chairman of the Health Service Commission explains the state government's investment in the sector and how it can be better.
The world is constantly evolving, and as such, the health sector needs to adapt itself to the changing dynamics through creativity, innovations such as technology, and embracing reforms. Health Service Commission has a responsibility to provide qualitative health service delivery to the entire populace of Lagos State and beyond its shores. There has been a lot of focus on capacity building, which is paramount in actualizing our vision of being a world-class human resource agency. The Commission has developed the capacity of all our health personnel to international standards, particularly trainings on the BLS, emergency trainings, ACLS, ATLS, and pediatric emergencies and obstetric emergency cares. HSC, therefore, has grown over the years and metamorphosed into the 28 secondary health facilities.
Experts in the sector call for more investment in the health system and cooperation between orthodox and traditional medicine.
Health sector started the private-public partnership in government. At that time, there was no office of PPP, either in Lagos State or in any state government at all. But the health sector championed it. And I'm laying emphasis on this, not necessarily for personal gain, but for you to appreciate the importance of what you are doing today. That you are on the right track, you don't even have a choice, is the way to go.
The Traditional Medicine Board is 42 years old, yet it's still crawling. I want the whole people here, this gathering, to please take something home, and that is, we need cooperation. We need cooperation between the orthodox and the traditional. It is not fetish the way people look at it. When you talk about fetish, you are moving towards the devil. Our parents and grandparents, ancestors have been living, taking care of their health before the servitude time came. With servitude, it looked as if they have emptied our brains. They have removed so many things that we think so little, we belittle ourselves. There's a misconception that must be changed. Traditional medicine is not fetish. We are working very hard to make sure that our culture and our traditions are retained so that the health system will be upgraded to the state that we have parallel health system between the orthodox and the traditional.
The handshake between the Health Service Commission and the Primary Healthcare Board needs to be strengthened so that we have a multiple-way referral system in place so that the patients can get a holistic care all the way to the community. So it's not sufficient to keep repeating the treatment of patients without referring them to the primary health centers closest to them. Secondly, I also think that we need to emphasize training on attitudinal change for our staff beyond skills acquisition so that we can improve the patient experience and quality delivery of services.
And the State Commissioner for Health, who doubles as the Deputy Incident Commander, Professor Aki Abayomi, says government will not stop at reshaping the health sector for the benefit of the people, which stands on an 8 strategic structure.
We've put in here 8 key strategic initiatives of the Ministry of Health. The first key strategy is to strengthen our regulatory and governance framework. We are going through a health sector reform review process so that we can make recommendations to the Ministry of Justice to strengthen our laws and to bring them up to date with evolving trends in biotechnology, ethics, and philosophy. We are embarking on major infrastructural transformation, and we are either at a process of significant new designs, and in some places we have been able to translate those new designs into ongoing infrastructural construction, and you will start to see the landscape of the medical infrastructure of Lagos State transforming over the next few years. The third item is to digitalize the health sector. And this is a major strategy of this dispensation. We're building what we call the Smart Health Information Platform. Again, that's a PPP, and we are at an advanced stage of designing the concept, and we have put out a bid, and we are assessing the contenders who are going to obviously have the skills to build a Lagos State Smart Health Information Platform, which we believe is going to make the system more efficient, is going to transform it, it's going to include the evolution of digital technology that is able to move information very quickly within the state and internationally so that we can join the international community in advancing the level and benchmark services that we're producing in Lagos State. You will see that we're trying to strengthen our health financing structure through the Lagos State Health Insurance Scheme. And then we're going to establish a medical innovation and industrial zone. We learned from the COVID experience that we should not be caught unawares, and that Lagos State indeed needs to have a resilience such that we're able to develop our own masks, our own PPE, develop our own test assays, be able to contribute to the international community of scientists to develop vaccines that are suitable and therapeutic interventions that are suitable for our community.
The Secretary to the State Government, Falashade Jaji, who is representing the Lagos State Governor, also says government will continue to show commitment in skill enhancement and infrastructure development to help improve healthcare services.
The development of the health sector to adequately cater to the health needs of the people effectively and efficiently has been one of the key priorities of this administration, as expressed in the health/environment pillar of our themes agenda, which we have faithfully implemented in the past 31 months. The success we have recorded in the management of the COVID-19 pandemic, of which our state is the epicenter, is a testament to the quality and resilience of our health system. We must also accept the fact that the pandemic is a wake-up call for us to do more and bridge identified gaps in our healthcare system. Building a world-class health system is our goal and priority, because nothing less can complement the status of a mega city and the 21st century economy we all desire for our state. Achieving this goal would entail enhancing the delivery capacity of all health facilities at primary, secondary, and tertiary levels in terms of availability of modern health equipment, qualified and motivated health personnel, as well as providing a conducive environment for private sector participation in the health sector. As a government, we will continue to play the role expected of us to build a world-class health system that will not only curb medical tourism outside the country, but also improve the potential of earning foreign exchange from foreigners seeking medical care in our health facilities.
Deliberations reached at this 4th annual forum is expected to provide solutions to the challenges facing the state primary and secondary healthcare systems in Lagos.
This is where we call it a day on the program Dateline Lagos. Thank you so much for watching. I'm Ayotunde Balogun. Until next time, do remember to always stay safe.